Very common that I forget. Okay, good evening, everybody. My name is Dr. Betty Teh. I'm a consultant cardiologist. Today is the first segment of what I intend to do of a series of health and medical chat, and I like to call it Borak Borak Medica. And I have here with me my cousin, actually, Dr. Teh Jo Hun. Dr. Teh is actually a consultant public health physician. He has a PhD on public health, and he's now based in Cebu. So we want to discuss this hot topic about COVID vaccine because there are more skeptics than we thought that's possible. Is this problem a problem? Is it causing us to be worried, or is it giving us hope? So maybe we will just discuss how vaccine has changed the landscape of infectious disease over the last century or so. I think WHO gave a number of maybe that the fact is vaccine has actually saved maybe 23 million lives since the first vaccine has been created. Now, what kind of vaccines do we have, Johan?
I think if you talk about vaccine, we have almost 25 vaccine preventable diseases currently.
Okay.
Very established. For example, things like diphtheria, pertussis, tetanus, so many. If you look at it roughly, there's about 25. And of course, there are many new ones coming out in the horizon. For example, Ebola, we are getting vaccine for that. Dengue is already there, but some problems with it. Malaria vaccines, all these new emerging and re-emerging diseases, we're getting vaccines too. So I think one of the most, as you mentioned, one of the best success we had was smallpox. We managed to vaccinate smallpox. We eradicated smallpox. Yeah, many.
I think smallpox is truly eradicated because of the availability of the vaccine. So much so that the vaccine program was struck off. Yes, so we don't have to be vaccinated for smallpox anymore. I think since 1970 plus, 75, because we no longer have the disease. Polio was also at one time said to be eradicated, but unfortunately, because of anti-vaxxer then we saw a small outbreak of polio recently. So now vaccination is so important in our life that we have a program, okay, a policy on how vaccine should be given patients, especially in childhood, during the childhood time. A lot of the vaccines are given during after giving birth, after being born, in the first few days of life. And this vaccination programs or policy, who actually makes them up?
Of course, for Malaysia, it will be our Ministry of Health. We have what do you call it? Steering committee that decides on what vaccination should be given. Of course, the latest one being pneumococcal vaccine, which was just launched yesterday. Of course, pneumococcal, to get the vaccine approved to become our national vaccination program, took a long time actually, because so many things to consider.
Yes.
So we have to consider
it's a very expensive
cost. $90 million for per year.
Yes. And I think the HPV vaccine was also incorporated into the program of free vaccine, right? Okay. HPV vaccine actually helps reduce the risk of cervical cancer. So it's given into to patients, not patients, to adolescents, mainly women.
Yes, of course.
Okay. Now, vaccines can come in many forms. Sometimes most of them are injectable. Most of them are either live vaccine, means they are part of a virus, or they could be a recombinant of a DNA, which there's no live virus whatsoever. But let us go into this. Let me say hi to certain people. Cindy Ong said good evening, and she said great news. The British are going to be vaccinated by next week or so. True. The British has bought the Pfizer and the Pfizer vaccine, and they are going to start vaccination next week. And Cindy said it's good news. So it is good news because there are people pro the vaccine, and there are more people actually. And these people are not anti-vaxxer, but they are very skeptical about this vaccine. Now, there are few phases of clinical trials when we do any trials in human being. And of course, a phase 1 trial is just a small trial to see whether the medication or vaccine is safe or not. Okay. Then the phase 2 trial, they then try in a bigger number. And now everybody knows about phase 3 trials, because everybody is talking about phase 3 trials. Now, actually, there's already been 2 vaccines in the market, and those are Russian vaccines, and they have been given without going through phase 3 trials. So we are more skeptical. Because why are we skeptical? Mainly because as we can see the history of vaccination, when a disease is, we know about a disease, sometimes it takes 30 to 40 years to develop a vaccine. And HIV has been in the scene for maybe about 50 years, 40, 50 years now, and we still have no vaccination. So, Johan, what do you think about this vaccination that came about within less than a year of this COVID? What's your opinion?
Of course, many people are very skeptical and saying that, or how they managed to develop so fast. But I think it's also possible because technology has now grown matured. For example, the speed at which they isolated the
RNA segment.
The genetic
yes, the
component
RNA
of this virus.
genome, yes.
The whole genome, yeah, within few weeks of
yes,
detecting
the Chinese
virus,
actually shared this RNA genome within a few weeks when the Wuhan outbreak.
Yeah, so the technology is very mature, especially genome sequencing. It's very mature now, and the sharing of information across borders, across the world, has been actually very, very good and never happened before in the past. So that's one of the reasons why they're able to do it with such speed. The genome, the sharing
But
of the genome.
having said that, and you know, Moderna is actually a company that specializes in RNA research and formulation of new techniques or new drugs or new vaccination related to RNA. That's why they could come up with probably this. But this vaccination would be the first RNA vaccination for any disease. Am I not right?
Correct. It's the first time we're using mRNA vaccine in a large scale. Of course, there have been trials in the past, but I think this is the first time we are using it in a large scale. And both these companies have already vaccinated. I think if you combine Pfizer and Moderna, almost 70,000 people have already been vaccinated with these 2 vaccines for their phase 3 trial. And nobody turned into zombies or anything. So I think people are too worried about.
Yes, it's funny because where I work, Sunway, we were just having a discussion in the doctor's lounge, and there were many who voted against taking the vaccine. I am for taking. I would be the first to be on the queue and say, please give me the vaccine, and I will book my first ticket for a holiday. Yes, but being skeptical, I mean, it has its, I mean, everybody has its own what you call thoughts and perception of what may or may not be. Of course, we may not turn into zombies, but then again, it is not something that we should dismiss all completely, because when they developed the polio vaccine, I think there was a mishap. There was some patients actually developed polio after the vaccination. So some kids developed polio after the vaccination, and then they had to recall the vaccine. And then there were one time when they developed the polio vaccine, there was another virus in the vaccine, simian monkey virus. And this simian monkey virus, though it did not cause any harm, it was detected in a large batch of vaccination, because they use this cell from the monkey to actually get this vaccination content. Now we have a question from Ryan Cole, and I think his question does not actually it's not related to the vaccine. He asked, can you explain why Malaysia has reached 60,000 cases, whereas Vietnam has only 1,300 cases? I think this explanation of how it's spread, it's very difficult, because if you look at US, and if you look at very strict areas, okay, even where mask wearing is a culture, like in Japan and in Korea, and you will see on and off an outbreak. Okay? And once you have an outbreak, a cluster, it is very difficult to control. So I cannot explain why Vietnam has so few cases. So I'll like to say hi to Mario, and then we go back to the vaccine again. Now this vaccine, okay, there are many vaccines in the, how many? I think there are probably about 90 over companies that are developing vaccines at the moment.
Yeah,
And
well,
some more ahead than others. But I think this vaccination is very different from one company to another. Even though the virus is the same, the RNA segment is the same. Some vaccines are live vaccines, some are not. And I think there is a company that is doing oral vaccine, very similar to the polio vaccine. But the Chinese companies has been very quiet, right? Johan?
Actually, they are one of the first actually to come up with the vaccine. They use a live attenuated system. That means just take the virus itself, they kill it with some chemical, and they inject it back. That means you don't know what's inside. It's some parts of the virus, and you get immunity to a whole bunch of things because it's the whole virus itself. It's got so many subunits. That's what happens when you inject a live attenuated virus. So the guarantee is not so good. You don't know whether you actually generate antibody to the correct things. Whereas the Pfizer and Moderna one is the antibody is very specific to the protein on the surface. The surface protein that helps the virus to enter into the cells. So your antibodies will actually target that specific protein that blocks the virus from entering into the cell. That's why it's so effective. It's very specific.
But the Chinese vaccine, apparently they have already vaccinated about 10 million people.
Yeah, true.
And these 10 million people, it's not stated whether these 10 million people are in a trial, like a phase 3 trial, or is it part of the vaccination program? They have been actually quite quiet about everything.
Yeah. The only data I heard was that 56,000 people sign up for this Sinopharm vaccine, and they were allowed to travel overseas, and none of them were infected.
Turn into zombie.
Of course, they won't turn into zombie because there's no genetic material inside. But actually, there is genetic material. it's just dead virus, right? Dead virus also contains genetic material. So what's the difference between that and an RNA? An RNA is not a DNA actually. It's
Yes,
just
it's
a
not.
messenger RNA. So
I think we know very little about,
the Chinese
I
one,
mean,
yes.
yes, the disease in itself, we know very little because it's a new disease completely. Okay. But what is interesting is how is Pfizer and Moderna's vaccine going to be distributed when they have to be stored, okay, in a frozen -70 to 80
Yeah.
kind of environment? Means they have to be kept in this temperature for it to work. How would distribution be even possible?
I think not a problem for Malaysia, because even in Cebu itself, in Cebu Hospital, we have 2 or 3 of that fridge, -70 fridge available.
Really?
So
But most
in most
vaccines are
of the
kept
big
between two
towns,
to
it would
six.
be
Most vaccines are kept between 2 to 6 degrees.
2 to 8 degrees,
Yeah,
2
2
to
to
8
8
degrees.
degrees.
Yeah, yeah, that is for distribution. Yeah, for deep storage, for long-term storage, is still at -70. At most of the central store in state level stores, they have -70 fridge already. Like in Sarawak, we have many stores that have this fridge in many of the major towns in Sarawak. So that one is being used now to store vaccines for long-term storage. So they will distribute out to the various clinics slowly and to be stored at the 2 to 8 degrees Celsius. So the same distribution will take place if it's a Pfizer vaccine. It will be shipped -70 to all the various stores and the hospitals with -70 fridge. Many hospitals do have that -70 fridge available already.
Oh, so in Malaysia, this should not be a problem because most
No
of the
problem.
in Ministry of Health, we do have this fridge
Yes,
that we're talking about.
we do have
And
that.
then, do you know, let's say we take it out from this -70 to -80 degrees
Yes.
fridge. How long can it last?
There was an announcement by Pfizer that it's able up to 5 days
Oh,
from
I
the
see. Okay.
-70. So you can take it out, you can distribute it to local and be used up within 5 days. So it's still possible. Distribution is possible. Yeah.
Okay. Ryan again asked, is the Russian vaccine safe then? We don't know the answer to that. We really don't, because sometimes the data are not made known to us. Sometimes, like Johan would say that it's usually a press release if there's any
Yes.
information at all. We don't get from journals or write up, okay, that is in a scientific form. Okay. And I think it's too premature for us to know, because we just started about maybe a few weeks or months with the vaccination. The only problem we have with this Russian vaccine is that it has not gone through this proper trial that we as scientists or as doctors accept as clinical trials. Okay, means if a medication or vaccination is new and it has to go to the public, it has to go through many phases of trials. And the phase 3 was completely dismissed in this Russian vaccination. And if you have any questions, do message me. I can now doing it better. I can read this message. And then there are quite a lot of people watching in. And so you think that the distribution and the temperature is not a problem. But do you then foresee the supply, okay, to meet the demand? Would that be a problem?
Always a problem. But
Always
there
a
will
problem.
be, because our PM only announced a certain 20% of the population will get the Pfizer vaccine.
20%.
6 million dose we signed agreement for by end of next year. Only 6 point something million dose. Of course, we also ordered those from China. We also made
Sinopharma, I heard.
yeah. So I think with all these companies, later we will also sign agreement with AstraZeneca, whatever, all these other companies that will cater for everybody in Malaysia, but the supply may not come by next year for everybody.
Yes, so it will still be a 1 whole year of life without vaccine. And then at the end of next year, we would probably know whether the vaccine will work.
Yes,
okay?
True.
Of course, some of them are saying 95% protection or antibody. 95% of patients develop antibody against the virus. But AstraZeneca actually apologized recently. Was it AstraZeneca?
AstraZeneca, yeah.
That
vaccine.
That the vaccine was not 95%, it was 60 or 50 something percent.
No, there's some problem with the data, actually.
Yes.
The AstraZeneca Oxford vaccine, some problem with the data, yeah.
Yeah, so we need to, again, because the capitalism in pharma companies we can't run away from. And then they would try to milk out possibly data that we are not sure of. Okay, there are even some articles in the Pfizer or Moderna one that say yes, 95% can be protected, but doesn't mean they're not effective. That they say that you can be protected, but doesn't mean that when you have this vaccination going on, that you can't spread the disease. So I think that that statement is a bit odd because first, when you are vaccinated, you're probably not having the disease. Okay. Then if you are protected, how do you spread a disease if you don't have a disease? Have you read that?
You can carry physically. It's still possible, you know.
Do you think it is possible?
Yeah, you can carry the virus physically, not only on your clothes. And
I see, like a surface.
Yeah, surface, your clothes, and also in your oral cavity. The virus may enter, but it doesn't have the opportunity to attack you. But it can be in your oral cavity or in your nose. Possible, yeah.
Okay, Mr. Loy Boon Ho said, if safety issues is not answered, then why should you be jabbed? Okay, I think so he's thinking, unless and until all safety issues are out in the open, that we know that it is very safe, then we should not be jabbed. But then again, these safety issues can be maybe very small. So for me, if I think that it is just maybe a low-grade fever for a day or two, which is very common with some vaccination, I say by all means, why not? I don't mind taking it. Okay. Some people say if it's like, of course, if it's safety issues like transverse myelitis, whereby you actually get paralyzed, or there was a vaccination that caused Guillain-Barré syndrome. Okay, in a haste of producing the vaccine, they caused this neurological illness that was very rare, and of course, then we need to question. But so far, with the Pfizer and the Moderna vaccine, they not come across any very severe adverse effect. So that sense, okay, it could be our only hope to save mankind. Possible? Johan?
Yeah, it's quite astounding, you know. For Moderna, what information I'm able to get is that they compare two groups. You know, the one who was vaccinated, only 11 of them caught COVID-19, compared to the unvaccinated group, 185 that were not vaccinated developed COVID-19. So that's how they managed to get the 95% efficacy. Yeah. 11
So
versus 185. So it's quite astounding.
when you have a value like that, it is very obvious that the
Something
vaccination, yes.
it works. Yeah.
But sometimes when you do a trial or search of, a study, sometimes the difference is not so
Yes.
so obvious. So
Yeah.
you need to do statistical
Yes.
test for it. But I think this will all probably be done. Definitely,
Yes.
it must be too obvious. Um, Aman Ismail Ibrahim say commercially the demand could be high, but do people really want to go for it? Yes. I read an article that when they did a survey, only about 54% of general public wanted and get the vaccine. And these are not your general anti-vaxxer. And I wonder why. Maybe some of you may want to tell me, if you do not want the vaccine, what is the reason behind it? Okay. And then when we get the vaccine, and even towards the end of next year, I'm sure there will be tiers of people, like there will be triage to say who will get the vaccine first. Who do you think will get the vaccine first, other than the ministers? And if they are safe, our country is.
Of course, the frontliners will get it first. The ones
Yes.
who are being what they call the highest risk of exposure to the virus, the frontliners, with the doctors, the nurses, all these who work in the wards, who are in the first line triage, who see patients every day. These are high risk people. Definitely, they will be the first to get by March, hopefully. And then subsequently, the next category, the public with high risk, those above 65 years old, multiple comorbidities like diabetes, hypertension, etc. So that would be the priority.
And then I think school kids will be the least priority, because in actual fact, the numbers of infection during school period is actually quite low, right?
Yeah, 0.03, something like that. That was
So
among children.
children are actually less infective than adults. Nicholas, you asked about the Dana study, and she said out of the two groups, I think the two groups is talking about maybe Moderna and Pfizer. How many died?
None.
I don't think anyone died.
Nobody died.
I think there was a death in the maybe another group of vaccine, the AstraZeneca, which was a Brazilian guy. But when they look into it, he did not die because of the vaccination. Yes, it was not due to the vaccination. He died of other causes.
He did not receive the vaccine, actually. Yeah, he was in the group that did not receive the vaccine, because
he was in the arm that didn't receive the vaccine.
Yeah, exactly. It's
the Brazilian
double blind.
guy.
It's double blind because initially they don't know who received and who. This is called a double blind, where even the patient and the doctors don't know who actually received the vaccine.
So when we do studies, right, like this type of huge clinical trials, we do it double blind. Double blind means the person who is giving the vaccine, the doctor, or we also don't know, the patient does not know. Okay, we actually randomize the patient through a system. Means we will get the study person, and then we will then call up to, let's say, a center, and the center say, okay, give this. And this, let's say A, we don't know whether A has the vaccine or do not have a vaccine. Okay, it has to wait until the end of the trial. Then only we open up everybody's data, and then only we will know who gets the vaccine. And so sometimes we have to open this data earlier than the end of the trial. Let's say a lot of people died, so we need to. So we stop the trial and we. So yes, the person in Brazil, I think it was either the AstraZeneca group, did not die because of the vaccine.
Yeah.
Aman said, I think the next one to get should be travelers. Okay. Since I heard airlines and countries require proof of vaccination before the travel. Yes, but everybody wants to be a traveler. So that would be everyone. Hi Simon, how are you? Shafiq used to work with me. So if you have any questions at all, please send it to us. And Ryan is very active. Ryan says, now vaccine is found and COVID virus is going to be killed by the vaccine. Okay, the vaccine does not kill the virus. I need to make the statement really. The vaccine prevents the virus from spreading. It prevents us from getting the virus because with the vaccine, we would have developed antibody against the virus. But at any one time, do not think that the vaccine kill the virus. Do you think that tourism can restart by the end of 2021? Can we leave? Okay, we cannot predict the future. Okay, we would not know by the time we get the vaccine whether the virus may have mutated. And then again, you must remember the vaccine is not one dose. I think they said that the vaccine has to be doses.
2 doses, yeah.
Yes. And then we do not know, once you have been vaccinated and you have protection, how long this protection is going to last. If it's going to last 4 to 6 months, then it defies a lot of it's really, really going to be a big, huge headache for everyone except the producer of the vaccines. Okay, so you still don't know many things. You don't know how long the vaccine is going to last. Okay, and then what happens if there is a mutation virus? As you know, in the flu vaccine, okay, you need to take it every year because first one is that not because your antibody reduces, but because the new flu viruses coming out as well. So there is still many things that is unknown. And I have never heard this. I know there's 2 vaccination, but have they actually come up with a time frame between these 2 vaccinations?
I think the study is 1 month apart, but probably once they have further refined the analysis, they will find the best time. Within that study group, also there are subgroups within that study group.
Yeah. So you must remember that because the vaccine now is, the news about the vaccine is maybe about less than 3 weeks now. The Pfizer vaccine, Moderna vaccine. And so we really do not have enough subset of patients that have gone through to see the antibody level, whether when it drops. Okay.
Yeah, we don't.
So for all you know, they develop 95% develop antibody. But let's say the antibody drops after 2-3 months. Okay. Wow, then it would be very difficult because at this present moment, if I'm not mistaken, when they study subjects that have had COVID infection before, okay, their IgM antibody drops quite rapidly, right?
Yes.
I think within 3 to 4 months. So what I'm trying to say is, once you get an infection, okay, your body will actually form antibodies against the virus or infection, okay? And that you assume would protect you. But the problem with COVID virus is that we are not sure whether one, you actually form antibodies, okay? And how many percentage of people form antibodies. But we have more data on that. But we also know that quite a lot of them actually deplete their antibodies quite fast. So I am not sure whether we can actually be very hopeful about the vaccine at the moment, but it is a glimpse of hope actually to me.
Yes.
I think I would go for the vaccine, definitely. Maybe you all can take a, I tried to do a poll, but I don't know how to do a poll on how many people would go for the vaccine. So I actually checked the internet, and then it says about 54% of people only would take the vaccine.
I think more, it will get more and more once it's more established. A lot of people are taking. People may change their mind, I feel.
Yes, I think it's like anything new.
True.
That people would just wait for more outcome, more data,
Yeah, true.
more people taking the vaccine. So when they see their friends actually getting travel, yes, then they would want the vaccine too. I think anyway, we have now spoken for almost 40 minutes. I think we will stop here. Please send in your question. We will try to answer your questions in this live chat thread. And I'll see you next week. Thank you, Johan, for coming in.
Welcome.
And next week, we speak to Dr. Lai, who is actually a consultant child psychiatrist on autism, which is also a very common problem these days. We see whether it's something new. I have no idea whatsoever. So we will speak to him in another session of Borak Borak Medica. See you guys. Bye. Bye, Johan. I see you. I don't think I can see you for Chinese New Year, yeah?
Yeah, after we get the vaccine, that was.
Yes. Yes.
Okay,
Let
bye.
us be the two first ones to get the vaccine.